Today I have in front of me a very famous doctor, Dr. Rammohan. So before we begin the program, I kindly a brief introduction about you to our viewers.
Good afternoon everyone. I am Dr. Rammohan, MD Internal Medicine. I am practicing in Kadalur for the past 23 years in the field of internal medicine as well as some special focus on diabetology.
So Dr. Rammohan, I would like to understand, first of all, how far is fasting good for a diabetic patient? And do you advise, if yes, if they fast, what are the precautions that they need to keep in mind while doing it?
Okay. Fasting is a good option for both diabetic and non-diabetic in this fast changing world. Fasting, a diabetic can do a fast provided he takes certain precautions and he adjusts the dose of the drugs according to his physician's advice. But there are certain people who are a diabetic who have to be excluded from this list of fasting. They are a type 1 diabetic who requires a higher doses of insulin and he has to be on continuous feed. Second is a old age or a pregnant lady, old age with dementia, urinary tract infection, active urinary tract infection people from fasting, and people with active foot infections also have to be excluded from fasting. Now coming to the most common drugs which have been used for cost effectiveness are the sulfonylureas. These drugs have significant effect of hypoglycemia, so the old drug glibenclamide has to be stopped, and the modern sulfonylureas like glimepiride and glyclazide have to be reduced. The dose have to be reduced significantly according to the type of fast he is involved. Now coming to insulin, if the patient is on insulin, definitely certain type of insulin require dose adjustment. Suppose the patient is on meal time insulin, so if he takes a meal, he takes insulin. If he is on fasting, we can skip that thing. So for a rapid acting insulin, this is not a problem. For pre-mixed insulin, which is commonly used, it acts at least 12 hours. So there should be half of the dose reduction in both pre-mixed insulins, as there is a chance of hypoglycemia. For a basal insulin, definitely a dose reduction of 20 up to 40% has to be recommended.
Doctor, can you just tell for our viewers what will be your message in terms of how they can prevent or control the diabetes?
The main problem with the diabetes is insulin resistance gradually going on to insulin deficiency. So the pre-diabetes incidence is now rising. So that can be prevented by a good physical activity. That is the main cornerstone of diabetes. The other thing would be a good balanced diet where you consume a lot of fiber, protein as well as a low carbohydrate content. Along with this, if you develop a diabetes, get the advice of the doctor and continue the drugs safely.
Thank you so much, doctor.
Thank you.